Imagine a sudden, urgent medical crisis where every second counts, and the right action can mean the difference between life-altering disability and a good recovery. What kind of rapid medical response is needed when the brain's critical blood supply is suddenly blocked? For a blood clot stroke, medically known as an ischemic stroke, the urgent treatment revolves around one primary goal: restoring blood flow to the brain as quickly and safely as possible. This involves medications that dissolve the clot and, in some cases, procedures to physically remove it. The reason this speed is so vital is due to the brain's extreme sensitivity to oxygen deprivation. When a blood clot blocks an artery feeding the brain cells begin to die almost immediately. Doctors often refer to the concept of time is brain, meaning that for every minute that passes without blood flow, a significant number of brain cells are lost, along with their functions. These urgent treatments are designed to minimize this damage and preserve as much brain tissue as possible. Therefore, if you or someone you are with experiences stroke symptoms such as sudden weakness or numbness on one side, trouble speaking, vision changes, or severe headache, it is crucial to call emergency services immediately. Once in the hospital, doctors will rapidly perform diagnostic tests like a CT scan or MRI to confirm it is an ischemic stroke and rule out a bleeding stroke, which requires very different management. They will also determine the size and location of the clot and the time of symptom onset. Two main types of urgent treatment are often considered. One is intravenous thrombolysis, commonly with a medication called TPA, or tissue plasminogen activator. This powerful clot-dissolving drug is most effective when given within a few hours of stroke symptoms beginning. The second is a mechanical thrombectomy, a minimally invasive surgical procedure where a specialist uses a catheter to physically extract the clot from a large brain artery. This procedure can be effective for a longer window, sometimes up to 24 hours after symptom onset, depending on individual patient factors and specific imaging findings. It is a highly specialized procedure, often done in comprehensive stroke centers. Understanding that timely medical intervention is the most critical factor empowers you to act decisively if a stroke occurs. Swift action to get immediate emergency care not only increases the chances of receiving these life-saving treatments, but also dramatically improves the potential for recovery and reduces long-term disability. Remember, recognize the symptoms, call for help, and let medical professionals initiate these urgent treatments.